My name is Dan Barzee, and I have type 1 diabetes. Type 1 diabetes basically means that your pancreas doesn't work, it doesn't produce insulin. Type 2 diabetes is your body produces insulin, your pancreas produces insulin, but your body is resistant to that insulin. So with type 1, I'm insulin dependent, so that means I have a pump, and I have to take insulin every time I eat something. With type 2, it kind of varies. Sometimes they need to take insulin, sometimes it's like an oral medication, or they can just exercise and manage it different ways. I was diagnosed with diabetes when I was 5 years old, so I was in kindergarten. My oldest sister actually had diabetes before I did. My parents noticing symptoms, they recognized it a lot faster with me than my sister. So when those symptoms started, they took me to the hospital, did lots of testing and things like that, and the end result obviously was you have type 1 diabetes. The less carbohydrates I eat, the better. So that being said, with pumps it's so amazing because it's basically like an artificial pancreas. So I'm not like super limited in the things I can eat, but the less carbohydrates I eat, better. But there are some days where you kind of splurge, have some ice cream or something. But yeah, so less carbs, better. No restrictions as far as things I can't do, but it's highly suggested that I exercise frequently, and it makes a large difference in my blood sugar numbers. I have to exchange my pump every 3 days, so it's a device that's probably about this big, and it goes on my skin, and every 3 days I have to take one off and put a new one on. And so it's a pretty simple process. It's just you just exchange insulin and put it on my body and tell a machine to insert they call it a cannula. It's a tiny little tube that goes in my body and releases insulin in my body for me. The major differences are that I have to monitor a lot of things. So the first thing I have to monitor are the things that I eat. So every time I eat something, I have to calculate the number of carbohydrates that I'm consuming. Second thing I have to monitor is my blood sugar. So before meals I check my blood sugar, and after meals a few hours I check my blood sugar to see if it's peaked or spiked or whatever. Again, also monitoring my exercise to make sure I exercise frequently enough to maintain my blood sugar. So I think the biggest difference between me and someone who doesn't have type 1 diabetes is just that there's a lot of thought going into my everyday things that most people don't think about. Due to the fact there's so many medical advances today, living with diabetes today is easier than ever. And that truly is a blessing of modern technology and doctors and scientists working to improve our condition. And I'm so thankful for that. With all those things, of course, life isn't easy, it's not perfect. But the thing that I like about the medical devices that we have today is that it makes it easy to live. And I'm able to live just like anyone else lives. I can typically eat things that I want to eat as long as I calculate it correctly and monitor the things that I am eating.